Tess asked me to show you around.
Right, I'll leave you with Toby. He's a dislocation king.
Well, I've done it for you. Staff Nurse Faldron. Eli, Staff Nurse Faldron. Eli has narcolepsy, so he may fall asleep at some point during the exam.
Don't take it personally.
No way. Just like that?
He's asleep.
Look, you can just watch him for a minute. I've got to go do something.
Okay.
You never mentioned you had a brother.
Must have slipped my mind. I seem to remember you having a bout of amnesia about a husband and a couple of kids.
Yeah. Quite a lot we don't know about each other, isn't there?
Yeah, I guess.
We managed to save the mother. The boy had a severe pelvic fracture and was in intensive care for several weeks. It was a very difficult case across many disciplines, but I think we pulled together as a team.
Thank you. I'm delighted the case went well for you. Tell me, how did you feel?
I was pleased. And tired. We'd all worked very hard.
Excellent. Now then, what procedures are you comfortable doing without supervision?
Standard skin closure and suturing, arterial lines, central venous lines, chest drains, I&D of superficial abscesses.
I can see I won't be called in every 5 minutes to nanny you. Maybe we should touch on stress management?
Oh, well, nothing is more stressful than an ED shift.
Dr. Winters, could you give us an example, please, of when things didn't go so well? And how you would change it next time?
Yes. Let's see. Well, there have been hard cases. Cases that are hard to diagnose. Would that do?
For example, if you were to lose a patient, how would you cope?
I would record the time of death and inform the coroner.
Anything else?
Ask for tests.
Fundamentals, Dr. Winters.
Perhaps on a more personal level?
Sorry, could you repeat the question, please?
Relatives, Dr. Winters.
Of course. Of course, I would inform the relatives.
You have a patient who's bleeding to death from a liver laceration. He's hypervolemic. He needs an emergency laparotomy and blood. He's refusing to consent to surgery or transfusion. He says he wants to die. How would you cope? What would you do?
In all honesty, I would hand the case over.
Thank you, Dr. Winters. I see from your portfolio that you have excellent references from your colleagues. You're efficient, you're punctual, hard-working, thorough.
Thank you.
Adam, hey. Alex seems really nice. Is that the best in you?
You should see me thrashing with Galactic Force 4.
What you said before about keeping things hidden, you were right.
What, aren't I usually right about everything?
Adam.
There you are. For my beautiful, gorgeous wife.
Thanks.
Sean, you hopeless romantic, you.
Well, I'm about to become a father again, so I've got to get the romance in quick.
Oh, Jessica, that's fabulous news. Thanks. I just found out recently.
Well, I'll leave you to it. I just wanted to find a home for those. I'll see you later.
Congratulations.
Wow. Departmental baby, that's, yeah, that's really wonderful news, isn't it? Bro, we're gonna have to bump up our babysitting rates, I guess. Alice, you want to start a name sweepstake or something? Wow. Listen, guys, I'll go chase up some reports. I've left them lying around. I really shouldn't do that. No problem.
Are you okay?
Yeah, fine.
Gary Forrest's wife's come in, needing some TLC.
Okay, Just check it out. No, have you seen Dr. Truman?
Well, I'm supposed to keep tabs on everyone now, am I?
Are you Mrs. Forrest?
Oh, I'm not stopping. I just... I thought you'd better have that. They said something about putting it back in.
Well done for finding it. Look, why don't you stay? Shall we let your mummy have a sit down?
So you're getting well loved now, in the mood.
It happens.
And she's all for it, and you're up for it. So there's this huge rush of emotion, which leads to the falling down business. Mate, gutted. What on earth does she do with you out cold on the floor?
Sometimes they stay, usually they don't.
Mate, that is bad news.
Yeah, I suppose the easier option would be like, TV and pizza for one.
What? Eli's a red-blooded male, Toad.
Yeah.
You don't want to give up that easy.
Yeah.
I sleepwalked across the whole city for a gorgeous blonde.
No.
So what would you do for love, then?
Let's give that shoulder another go, shall we?
Yeah.
Is that all right with you, Eli? Okay, feel free to tuck into that Internox any time.
Oh, no.
Right, this is impossible. Morning.
Did it work?
Sorry, mate.
Well, this isn't working. Look, the Entonox is setting you off. The pain is setting you off. We're going to have to try an IV sedation. Eli, I'm just going to go and find another doctor, OK?
I heard he was suspended for gross misconduct.
Really? Toby, have you heard this rumour about Ben's suspension?
No, that's awful.
Well, I'm sure it'll come out sooner or later. These things don't stay confidential for long.
Thank you. Wait and see what the outcome is.
What's the point? I mean, that's my surgical career done and dusted.
Trust me, Ruth, you will make an excellent surgeon when the time is right. Sometimes we need our wings clipping for our own good.
You stitched me up.
Well, so you'd rather listen to her than me? Some sad fantasist who gets a kick out of screwing with other people's
Dr. De Silva! Sorry!
Sorry.
There is a time and a place. Walk with me. I take it that was about Ben Harding?
Yeah, that is a complete misunderstanding. That is wrong.
Well, why would Ruth think you've been put under pressure?
I don't know, but she's wrong.
Toby, your patient's asking for you, excuse me, and Jay's not too sure what to tell him or indeed where you are.
Actually, I quite like your opinion. I've got a cataplectic patient with an anterior shoulder dislocation.
Right.
I think he needs IV sedation, but I'm a bit worried about his airways if he keeps falling asleep.
OK. We'll go and have a look. And then we can discuss your other concerns at a more appropriate time.
The consultant called me stupid for not coming in sooner and the waters are broken.
Yeah, it's tactful.
Gary backed the consultant, of course. It felt like a betrayal.
He's probably worried for you. And she's beautiful. So quiet.
I haven't dared put her down for 5 months. Let alone leave her with anyone.
Must be worn out. Why don't you come and see Gary? I know he wants to see you.
After what's just happened. God, things were bad enough before.
And situations can improve.
Fat chance. We'll never get over this, will we?
Mr. Jordan, about Ben.
Toby, this is some sort of doomed relationship fallout.
What, relationship? I'm not gay.
Damn it.
Oh, that's Adam's brother.
Hello, can I help you? It's tea, you moron.
Toby, will you fetch Staff Nurse Harrison, please?
No. Leave it, I'm fine, right?
Give us a minute. And get this place cleared up, please. Sorry about that. An obstacle course.
Oh, sorry. I was rude to that doctor.
He's heard worse, don't worry.
It's a bit of a pain. I'll
I miss my brother.